Hi, in this video we're going to show you how to use the DRX9000 cervical unit. So we're going to do this in 10 steps. The very first step is to enter in the patient's info. It's similar to the lumbar. You're just going to click New Patient. You're going to click on the name. You're going to put in the patient's name. You're going to put in an ID if you have one. Under comment, I recommend that you put the level you're going to treat. So for example, C5, and the head cushion size, which is S2 or 3, whatever you choose. Then there's a patient loading button. Now it has maximum load. That's the only thing that you adjust is the maximum load. It's usually 5 to 10% of their body weight. It's not so much about the force. I would definitely start off at 5% and then you can go up. And there is treatment profiles 1 through 5. We recommend on visit 1, profile 1, visit 2, profile 2, visit 3, profile 3, and forevermore, stay on 4, okay? And so that's all we're gonna do. So for somebody like Morgan, I'm gonna go ahead and start her off at 10 pounds, profile 1, and then next visit, we're gonna go up. The most I probably pull on her is maybe 12 or 14 pounds, but that is where you can use your own discretion and decide as a doctor what you're gonna do. You can also refer to the owner's manual for more specific information there. And that's it. When we're done, we just hit OK. And then when we're ready to treat, we click on Patient Treatment. We bring up the patient. And now we're ready to treat by hitting Next. And we're ready to go. So to start, you got to put the headrest onto the bed. So whenever we do this, I highly recommend grabbing it by the bottom plate, not by the handle, okay? And you can see there's a groove here. And basically, we're going to put this groove over the block at the top of the bed. The next step is to fit the patient with the head size that matches them the best. And here's what I mean by that. Each head cushion has a size printed right on it. The head cushions, they come from sizes 1 through 4. These will fit 99% of your population. So all we're trying to do is to grab the patient's occiput with the bottom part. I can tell you right now, looking at this, that's probably the right size. Most of your patients are going to be between 2 and 3. And basically all I'm going to do is come around, put this up against the patient's head, hold the forehead gently, and I'm going to go up and see if we have a good grip. What we don't want is we don't want to be grabbing them by their ear, and we don't want to be above their neck. It needs to be able to fit in the groove of the neck and pull up from the occiput. So we just put it up. Does that feel good? We're good to go. So then I'm going to put the head cushion in. The easiest way to put the head cushion in is it's got 4 holes on the back. We're going to put the bottom holes on first, and then it snaps right in. Now we're ready to put the patient on the machine. I'm going to tilt the bed up to bring the patient down. Another way of doing it is having a step stool where a patient can step on and lay down. But some patients have trouble doing that. Always make sure that the bed is slid all the way down. So all you do is press the bed down button on your remote or the bottom left-hand button on the remote. And then we're going to go ahead and ask the patient to step on and lay back. And then we're going to tilt the patient back down. So one of the first things I like to do is put the knee pillow in. It just feels good. Then I'm going to connect the headrest by pushing the button and connecting it. I'm going to put the safety pin in. And I'm going to go ahead and connect the USB. And I'm going to choose the angle of pull. Most of your patients are going to be C5, C6. Once you reach the angle of pull, it's very important that you make sure that the head cushion is slid all the way down prior to connecting it to the tower. So what happens is during this setup, during the movement, a lot of times this head cushion slides up. To get the best decompression, you need to make sure that after the patient's positioned and after you change the angle of pull, that they slide down. Can you slide down for me? So she just slid down, and now we're gonna be able to get maximum pull. The next thing I'm gonna do is connect the strap across her forehead, and I wanna go right above the brow, even touching the brow a little bit. So now we're ready to connect the belt from the tower to the headrest. Keep in mind that's the very last thing we're gonna do, right? We're gonna make sure that the angle has changed to the proper angle. So we already pressed C7, it went to that, or C5, whatever you're gonna press. We're gonna make sure that the head cushion is pushed all the way down so that we get the maximum leverage. We're gonna connect the head strap, and then the very last thing is connecting the belt. Now we're ready to treat, and now we're gonna hit run and hand the patient the safety switch. And that's pretty much it for running the treatment. Now once the treatment has finished, we're gonna go ahead and put the safety switch back, take the knee pillow out, bring it back down to the base level, and while it's coming back down to the base level, I'm gonna disconnect the strap, and I'm gonna disconnect the strap on the forehead, remove the safety pin, position the patient's feet so they land in the right area, and I'm gonna tilt the bed up. So after they're done treatment, you're just gonna do some e-stim and ice before sending the patient home. Be sure to always refer to your owner's manual and contact us with any additional information you may need. As far as YouTube and Facebook, be sure to subscribe to us on YouTube. We have lots of videos that are helping you, as well as on Facebook. We also have 2 events that are extremely helpful for every DRX9000 provider. And that's marketingdecompression.com. And we show anybody, whether you have a DRX or not, how to market your practice, how to better connect with the patients. Marketingdecompression.com, as well as our decompression mastermind. And we have a few of those a year, once in Dallas and once in Orlando. So go to decompressionmastermind.com to learn more about that event that I am sure you will find extremely helpful from a clinical and a practice perspective. Thanks again for watching us, and look forward to seeing you guys soon.